Welcome to Tuesday's edition of Arirang TV's special coverage of COVID-19. I'm Min San-hee. Korea's testing kits are being shipped to the US today upon request from the latter to the former, as officials there are seeking to tackle what is currently the largest outbreak of the virus with close to 590,000 cases. Meanwhile, as of this Tuesday, worldwide infections stand at well over 1.9 million. We begin now with the headlines for today with our Kwon Soa and Noaram. Welcome to the studio.
Hi.
Hi.
So let's begin with the domestic updates. I understand we seem to be stabilizing, is it?
Right. For the second straight day, we are seeing cases in the 20s, but we can't emphasize enough that we still have to remain on alert as there are still sporadic cluster infections and also imported cases and also patients that have retested positive for the virus. So health authorities are looking into whether this could be a reactivation of the virus or reinfection. And in fact, 83 out of 116 such cases of a relapse were reported in Daegu and Gyeongsangbuk-do province, which is, as we know, the epicenter of the coronavirus here in Korea. And as for new cases in those regions, there were 3 in Daegu, 5 in Gyeongsangbuk-do province, 2 in the capital Seoul and 8 in Gyeonggi-do province and 1 in Incheon and Ulsan respectively. And I think it's the first time that I actually got to mention each of these cases. That's how low the cases have become now. Now, in all, 27 new cases were reported today, raising the total to 10,564. The death toll stands at 222. Meanwhile, 12 of the new cases are imported, out of which 11 are South Korean nationals. And speaking of South Korean nationals, a group of 43 South Koreans and their families that arrived from one of the worst hit countries, Spain, yesterday have all tested negative for COVID-19. They are currently in self-quarantine. Still, there are many more South Korean residents abroad returning to Korea, which is one of the reasons why the government has remained vigilant. Also, according to the latest briefing on the coronavirus situation, a senior health official expressed quarantine authorities' concerns about tomorrow, Wednesday, when people head to the polling stations, calling on voters to continue following enhanced social distancing guidelines.
Despite the relatively optimistic figure, should I say, I'm not sure if I can use that word, but the decline. Officials warned that we're in a critical period, despite the slowdown.
Right.
And they mentioned Singapore
exactly
as an example of that.
They did that at the briefing today because Singapore was one of the countries that was praised for its initial response to the coronavirus, which included screenings at the airports in early January already, as well as contact tracing like here in South Korea. But now its local cluster infections are raising alarms as the country reported a record high of 386 new cases on Monday, bringing the total to more than 2,900. One person died, raising the death toll to 9. According to local reports, 280 of the new cases were related to existing clusters, while 4 new clusters were reported Monday, and many of those infections occurred at dormitories. While currently there are not many imported cases there, last month there was a rise in returnees from abroad that brought back the virus. So this is really showing that any country can be vulnerable to COVID-19. Even the #1 economy in the world, the US, where South Korea's shipment of test kits is due to arrive Tuesday. The US has more than 570,000 cases now, 23,000 deaths and 10,000 deaths in New York alone. Italy's death toll has surpassed 20,000, and France reports more than 98,000 cases and has extended its lockdown to May 11th. And those are the global updates I have for you.
All right, so thank you for those figures. Adam, another diplomatic event is being held to discuss anti-COVID-19 measures. Tell us more about that.
Yeah, well, we are talking, of course, about the ASEAN +3 meeting that is scheduled to take place in a couple of hours' time, in fact, 4 p.m. to be exact. It will be held via a video conference, as we've been seeing with these diplomatic events. They'll bring together the leaders of the ASEAN member states together with the +3, which are South Korea China and Japan. The main agenda will likely be ways to minimize the negative social and economic effects of COVID-19. Cheongwade says President Moon Jae-in will emphasize the need to strengthen regional healthcare cooperation and maintain global supply chains and essential business-related exchanges among countries. The leaders are scheduled also to adopt a statement to sum up their talks after that meeting.
We talked about Singapore just earlier, and Singapore is one of the 10 members of the ASEAN. So I think it's really appropriate that these countries are getting together, of course, virtually. And I hope that they are also going to talk about the potential of this reoccurrence in countries like Singapore, which was actually a really good example of how to respond against this pandemic.
Right, of course. Yes, Aram, the global race to find a vaccine is continuing, and the WHO has released a statement with regard to that matter.
That's right. The WHO starts off the statement by saying, quote, "We are scientists, physicians, funders and manufacturers who have come together as part of an international collaboration coordinated by the WHO to help speed the availability of a vaccine against COVID-19. That's how they started off that statement. It also stressed that a vaccine may ultimately be instrumental in controlling the pandemic. I think that's well known, widely known as the vaccine will prove crucial. The statement cited researchers from Korea, the US, China and many other nations who are joining the global effort to find a cure. It also said the group will, quote, "continue efforts to strengthen the unprecedented worldwide collaboration, cooperation and sharing of data already underway." Now, this coordinated move, the WHO says, will help reduce inefficiencies and duplication of efforts. So we can't have two countries doing the same thing. So they have to share the information together so that there isn't any waste or inefficient practices being made. In terms of the progress made, the WHO said in a separate document, in fact, that there are 70 coronavirus vaccines currently in development worldwide. 3 of those vaccines are undergoing human trials at the moment. One of them, the furthest that we've seen in progress, is one coming out of Hong Kong and China, which is in phase 2 and nearing phase 3, which will be tested on thousands of humans.
Right, I see. Now, as our Soa mentioned, we have the general elections coming up tomorrow, and authorities are focusing on ensuring that the virus is kept under control there.
Yeah, but as we saw in the early voting period, there have been various hygiene measures that have been taking place in order to stop the spread of the virus. We saw voters having to wear masks, they're having to have their hands sanitized, washed before they go in, and they also have to wear plastic gloves when they cast their ballots as well. Now, this is all well and good, but there are still ways for COVID-19 to be transmitted. Firstly, not everyone will adhere to the rules. We've seen people violating self-isolation and quarantine rules as well, and it's hard to keep an eye on every one of these voters, and there will be a few people who might take off their mask inside their voting booth where there are no eyes to watch them, and they also might take their plastic gloves off during that period as well. And we've seen people stamping their hands, as is usually the tradition in voting periods, but experts are advising strongly against that because that could increase the chances of droplet infection, in fact. Now, this droplet infection is a concern because even with masks on, they don't completely cover the face. They do have an opening. They can, any droplets from the mouth can escape through these cracks. And research is still underway to find out more about the virus and how it stays alive on certain surfaces as well. And some have suggested it survives of up to 4 days on glass and up to even a week on plastic or stainless steel. And if you look at the polling stations, there are various items that can be a route for infection, such as the stamps or the paper, the ballots themselves. And also when people are passing over their photo IDs, which they have to do when they enter, sometimes that could be done without plastic gloves being worn. So the transmission can happen from that as well.
Right, and which is why we're calling on members of the public to be especially careful tomorrow. Thank you very much, Aram. Thank you very much, Soa.
Thank you.
Now, it's a little after 2 o'clock in the afternoon here in Seoul, and we turn now to the Central Disaster and Safety Countermeasure Headquarters for the regular briefing. Health officials this coming weekend are expected to decide on the future course of the campaign to contain COVID-19 here in this part of the world. The expectation comes in light of the end of the social distancing campaign on April 19th. Many have been speaking about the launch of a comprehensive set of social preventative measures that would touch upon a wide spectrum of activities within the community, ranging from education, entertainment to eating out. we are still waiting for the briefing. And while we do, maybe we'll take a look at some of the figures that our Kwon So-ah gave us earlier in the broadcast. We have 27 new cases as of early Tuesday, raising the total number of infections in Korea to 10,564. Tomorrow, voters are expected to cast their ballots for the general elections, so we expect you to take special caution, as our Noaram mentioned, to make sure that the spread of the virus is curbed at the polling stations. We also noted 5 loss of lives yesterday, today that is, raising our death toll to 222. After the briefing by the Central Disaster and Safety Countermeasure Headquarters, we'll be going through a couple of the issues related to COVID-19, including the issue of xenophobia that has been sparked by this outbreak, this pandemic across the world. We'll also take a look right now as we wait at the numbers affecting the numbers worldwide. We have the US taking the top spot with more than 570,000 confirmed cases. The death toll there is equally as alarming, as we have more than 23,000 deaths. Spain, we have 169,000, more than that, of course, in confirmed cases, and the death toll there stands at over 17,000. Italy coming close at number 3. Italy, which used to be the epicenter of the outbreak in Europe, now stands third. We have the briefing now with our official approaching the podium. We'll be back after this briefing.
중앙방역대책본부 부본부장 먼저 설명이 있겠습니다.
Let us now begin our regular briefing for April 14th, Tuesday, on the coronavirus outbreak here in South Korea. The total number of confirmed cases stands at 10,564. This includes 940 imported cases, and 91.7% of them are Korean nationals. And 7,534 people have been discharged following full recovery. And we had 27 new cases yesterday, and we had 87 more people who were discharged. Unfortunately, we had 5 additional fatalities. And here is the regional breakdown of the cases. And aside from the imported cases, let us now look at the confirmed cases. And in Gyeonggi-do province and Gyeongbuk province, there were 5 confirmed cases each. And nationwide, 81.4% were related to cluster infection. And looking at the source of infection during the past 2 weeks, we had more than half of 52% which were related to imported cases, and also 8.6% were related to the secondary infections by the imported cases. And it was followed by the nursing hospitals as well as other medical centers. And yesterday we had 12 new imported cases, and the 9 of them were from the Americas, 2 from Europe, and 1 from others. And 11 of them were South Korean nationals. And by region, when you look at the cluster infections in Daegu, Dalseonggu district, we have the second Miju hospital, and we carried out testings on the people who were there, and we have 193 confirmed cases as of now. And in Ujeongbu St. Mary's Hospital in Gyeonggi-do province, we also have 2 more people who were tested positive who were on self-isolation, and the total now stands at 64 for this hospital. And we're seeing new cluster infection, which is garnering our attention, is the Yecheon-gun County in the Gyeongsangbuk-do province. And we have 25 confirmed cases there as of now. And the central headquarters, we would like to look at the figures of the imported cases, which is over 50% of the daily confirmed cases. We would like to ask all of you who are inbound travelers to abide by the quarantine guidelines. And persons who are under home quarantine are required to follow the quarantine guidelines, which include using their own utensils and belongings. And in the morning, after the KCDC meeting, we had a morning briefing, and we reported on the South Korean government's efforts to support the development of COVID-19 therapeutics and vaccine by establishing a pan-government support team. And under this team, we will have a team of working-level people, and these people will be consisted of the heads of the National Health Institute, as well as other research on science research institutions. And we will also look on the opinions of the academia, the medical experts, and as well as other private sectors, and this will go hand in hand. And at the same time, we will also, in order to develop the coronavirus vaccine, we will cooperate with the International Vaccine Organization to continue our global cooperation. And us here at the headquarters would like to highlight the following regarding the general elections to be carried out tomorrow. And we once again highlight the need for following by the quarantine measures. And in relation, we would like to highlight that you need to wash your hands before and returning from the polling stations, and wear your protective face masks when you are at the polling station, and have at least a distance of 1 meter between yourself and other voters. And please get your body temperature screened, and please sanitize your hands and wear the disposable plastic gloves. And please cooperate with the guidelines provided by the people who are at the polling stations. And in order to curb infection, please refrain from stamping your own hand with the voting stamp. And tomorrow, as we are having a public national holiday, please refrain from any public gatherings, and please comply with the social distancing measures going forward. And we have several more messages to the public. And in relation to coronavirus, we are witnessing a global difficulties, and we believe that this can be only overcome with the development of vaccines and therapeutics. The entire world is actually eyeing and exerting their full efforts to develop this, and we believe that this is also a very important breakthrough for South Korea as well. And thus, we have our pan-government support team to be established. However, we believe that it will not be easy for us to have a tangible result in the near future. And as time goes by, and even if we have the therapeutics and vaccines developed, we also would like to inform of a possible infectious problems after the vaccines are developed. And we still have a number of tasks at hand even after such development. So what we would like to highlight is the following. Even at this moment and even in the future, we believe that the everyday life quarantine is very important, and it will be very effective and a very crucial measure going forward. And as we have reiterated numerous times, even the world that we will have after COVID-19 will be very different from the ones of pre-COVID-19. We are seeing a disappearing of the handshakes, and as we check the weather every day, we are monitoring the outbreak trends of the global society, and we are practicing the coughing etiquettes like keeping your tissues and your hand sanitizers. These are the world that are witnessed before us after the outbreak of the COVID-19. And even if we have a different level of social distancing going forward, we believe that the high-risk category who are aged over the age of 65 or those who have chronic illnesses who are pregnant. These are the people who will be most inflicted by the virus, and these people need to refrain from going outdoors going forward. And we need to consider the fact that the COVID-19 could be also very harmful and very infectious even again in the future. We are walking a path that has not been taken. However, we would like to urge that we need to cooperate for the good of the society and the entire international community. That is all for me. Thank you very much.
네, 그럼 질의응답 시간 갖겠습니다. 지금 이 브리핑이요.
Right, that was the Central Disaster and Safety Countermeasure Headquarters with the latest on the COVID-19 situation. Korea has recorded 27 new cases as of early Tuesday, raising the total number of infections here to 10,564. Now, tomorrow, voters are expected to head to polling stations nationwide to cast their ballots for the general elections. Authorities are urging people to abide by containment efforts and to refrain from activities that raise their chances of exposure to the virus. And like we said, Korea's 21st general elections are poised to take place tomorrow, that is April 15th. The turnout for early voting that took place over the weekend hit a record high despite concerns over COVID-19 outbreak. In this next video, we share with you scenes from one polling station where stringent measures have been adopted to curb possible infections.
On April 10th and 11th, the 21st general elections were held here in Korea. 11.7 million voters took part in 3,500 polling stations nationwide, setting a record turnout of 26.7%. Also, in addition to their photo IDs, people were also required to bring their masks in order to vote. Many changes have taken place at the polling stations due to the COVID-19 outbreak. Temporary voting booths were also set up for those whose temperatures were measured at above 37.5 degrees Celsius. Enhanced social distancing measures have also been adopted, with voters maintaining 1 meter distances from another. After getting their temperatures checked for any fevers, voters can only enter the polling stations after sanitizing their hands and wearing plastic gloves that are handed out to them. Voters can finally enter the polling booth after pulling their masks down to verify their identity. Despite the added procedures and minor inconveniences involved, South Korea has been able to provide a safe voting environment.
투표 당일날도 예전 같을 때는 갔었는데 사람이 많이 붐빌 것 같더라고요. 저희 동은 주민도 많고 해서 당일날 가는 것보다 사전 투표를 하면 아무래도 덜 붐비고 사회적 거리 유지도 좀 더 수월할 것 같아서 미리 시간 내서 점심시간 피해서 왔습니다.
오기 전에는 좀 불안한 마음이 컸는데 막상 와서 보니 발열 체크부터 비닐 장갑도 나눠주시고 1m씩 떨어져서 설 수 있게 안내도 해주시고 해서 불안감은 좀 사라지고 투표 잘하고 나왔습니다.
With South Korea being the first country in the world to hold a major election since the COVID-19, can it provide any important lessons to the world on how it should be done?
Now, as our Noaram mentioned earlier on the program, the government has advised citizens not to imprint themselves with voting stamps at polling stations, which many have done in the past to take photos of themselves for their social media accounts. Meanwhile, those in self-quarantine will be able to vote from 6 p.m. but must be present at the polling station before that time and wait for instructions. They must travel either there by foot or use their personal vehicles, and are prohibited from using public transportation. With that in mind, be sure to take your role in maintaining a safe voting environment, that is, while making your ballots count. Countries around the world are imposing lockdowns as part of efforts to curb the spread of COVID-19, including Australia, which has now reported more than 6,000 cases of the illness. As of March 23rd, restaurants, cinemas and other public use facilities have been shut down, all across Australia. But COVID-19 is not the only virus the country is fighting. Our next video was sent in by a Korean national living in Australia to tell us more about the situation in that country.
Hello, my name is Min Park. I'm a visual communication designer. Sydney is the most popular city in Australia for tourist attractions, with over 8 million visitors every year. However, walking around the city these days made me realize how bad the current situation is. Streets are almost empty. I have never seen this before. Since beginning of March, Australian government has closed its door to tourists from overseas and later imposed full lockdown regulations, which has casted dramatic changes across the whole country. It's been made clear that gathering of more than 2 persons in public places is prohibited, and due to this, many sports games and major events have been cancelled. This outbreak is also affecting many young job seekers, including me, as the recent lockdown limits opportunities for job interviews, and with this economic situation, most businesses are not really employing new people. Despite this chaos and financial difficulties, Korean community seems to be getting stronger. I heard there's been movement among Korean churches, restaurants and grocery stores trying to help other Koreans, those in need, providing them free groceries, food and all masks and all the supplies. Just listening to this story, it just brings back all the Korean emotions. From 1st to 6th of April, a lot of Koreans went in and had a chance to vote from overseas, and they made the best effort to clean and disinfect the premise so they could safely vote. It's because Korea recovered from COVID-19 so quickly and dramatically. When this COVID-19 outbreak first started in Korea, I was really worried about my families and friends because it was happening so quickly. But now it's different. I'm more worried about being in Australia because there's much less medical infrastructures and support. And also there's been increased case of violence related to racism. Mainly targeting Asian people because I think some people believe the Chinese people are responsible for that because it first started from Wuhan, China. And there are a lot of young Korean students and people came for working holidays, and they not only struggling this lockdown regulation, but also from those racism. And one of the reasons they try not to go outside is this racism, and this is really frustrating. People in Australia were so confused and scared because this type of thing never happened before. But now it's getting better. People trying to use to it and then finding their own way to spend time home. And also all the local councils and businesses making their best effort to practice social distancing measure to keep people safe around. So I hope all you guys in Korea are doing the right thing, doing the same social distancing, and stay safe.
Now, as we just saw in the video, the COVID-19 pandemic has also had the unfortunate repercussion of fueling racist sentiments across the globe, especially those targeting people of East Asian descent. For more on this sad reality, we have Professor Hwang Myung-jin from Korea University. Welcome, Professor Hwang.
Good afternoon.
And we have Jason Strutter, a journalist for PRI's The World, joining us in the studio as well. Hello, Jason.
Hello to you.
And we have Professor Russell Jiang from San Francisco State University joining us live from the US. Hello, Professor Jiang.
Good afternoon.
Right, we'll start with you, Professor Hwang. This is definitely not the first time that the world is fighting a global pandemic, an outbreak, contagious disease that is. Has racism always been an issue during global outbreaks? I mean, what did we see in the most recent cases of MERS and SARS?
Well, disease fosters fear, which in turn fosters discrimination. It is very simple but repetitive in the history. The Black Death killed as much as a third of total population in Europe from 14th to 16th century. And the plague started from China and spread to Indonesia, Persia, Egypt, and arrived in Europe in 1346. And from then, it has been quite a strong bias to Asian people among the Westerners. In 19th century, yellow fever epidemic was spread in the United States. That time, European immigrants who were perceived to be more vulnerable to the disease were the primary target of the stigmatization. AIDS and HIV disease, which was pretty much, the fearful in the 1990s, gay people were targeted. Due to rumors spread that gay and lesbian were the causes and carriers of the disease. During the SARS outbreak, which originated in China, East Asian became the target of more blame. When the Ebola outbreak emerged in 2014, Africans were targeted. COVID-19 has brought a very similar pattern of social reactions. As the epidemic becomes a pandemic, the people got more fearful and panicky, and some try to find a way to ease their fear by finding out the target, the scapegoat.
Right, so fear is fueling the sense of xenophobia that we're seeing right now.
Exactly.
Jason, as mentioned earlier, we're witnessing a surge, of course, in racist attacks or racist comments against people from Asia. We even have soaring nationalist sentiments in Europe. And over in China, we have discrimination against people from Africa. What do you make of this alarming rise in xenophobic sentiments across the globe?
The pandemic is really bringing out the worst in many people, unfortunately, because of that. And this type of ignorance leads to racism and xenophobia. I mean, it's not only hostile actions directed at groups of people. I mean, I think this also applies to the race to develop a vaccine or hoard medical supplies. Many countries aren't going to want to share their personal protection equipment or other medications. For instance, America might not want to share the vaccine if it is able to develop that first. Countries are going to look at their own national interests over the needs of the global community. And unfortunately, this is a problem that is seeping down to the lowest level.
That is quite alarming. That would be quite alarming if that was the case then. Professor Jiang, I understand you helped create a website that tracks hate crimes against Asian Americans amid reports of horrific assaults against them, including an acid attack against an Asian American woman in Brooklyn. Is such violence, that is, escalating in light of COVID-19?
Oh, yes. The violence and the threats and the harassment due to COVID-19 are rampant in the United States against Asians. We set up our website immediately. Within 3 weeks, we've had over 1,400 cases of Asians in the United States being shamed, harassed. And the harassment isn't slight, but people are getting yelled at and actually spat upon and coughed upon. So it's a threat. And then 10% of our cases are actually, like you see, people being physically. So when you read through them, they're harrowing. It's quite widespread.
Professor, you're breaking off a little bit. Could you speak perhaps a bit louder?
The cases we're seeing are quite widespread and harrowing. Actually, Koreans in the U.S. make up 14% of our cases. So it's not just anti-Chinese sentiment. It's a case of racial profiling where people can't tell the difference between Chinese and Koreans, and so they just attack and scapegoat whoever they perceive to be Chinese.
Professor Tsiang, it's also been reported that minorities in the U.S., particularly African Americans, are disproportionately, that is, affected by COVID-19. Are systematic inequalities a major challenge in the outbreak there, especially with regard to healthcare access?
Yeah, it's a major problem of how there are structural inequalities based in our healthcare system against people of color. So African Americans, I think, are about 6 times more likely to be infected, and because they lack access to healthcare, because they live more impoverished and more crowded and dense conditions. Latinos, they're the most economically hard hit of all the racial groups. They work in the service sector. Those who aren't documented access to testing or any healthcare, and so they're more impacted. And again, Asians in America are scapegoated, and so you could see how this pandemic has really exposed the racism and the racial structure of the United States.
I see. Jason, do you believe that the rampant spread of fake news and rumors perhaps played a part in fueling the COVID-19 related xenophobia we're witnessing right now?
Certainly in countries where there's not a lot of trust in the government or medical professionals. Many people get their news these days over social media, Facebook, Twitter, what have you. And not all actors on these sites have good intentions. Now, I think some social media companies are doing what they can to stop the spread of fake news, but of course some continues to seep through. But even in established mainstream journalism organizations, sometimes hearsay gets reported as fact. Right, the need for real fact-based journalism is incredibly important now during this pandemic.
Right. Now, attempts to document the harsh reality of racism in the midst of a global pandemic have resulted in the making of a film about COVID-19. We have a short trailer of the production up next before we connect live with the director of the movie itself.
Do you understand that there's a virus going around in this building?
I didn't know there's a coronavirus in the building.
Yes, no room, no room. It's fine, it's fine, get on, it's fine.
China, that's where the virus is from.
You guys are acting like you're seeing an alien or something like that.
We just open the borders up, we let them in, and they bring their disease.
You all right? You sick?
Does not taste my baby, okay?
What the fuck is wrong with you, Josh?
Protecting my life.
This is how you all treat people, huh? This is what we do?
We're gonna die. We're gonna die.
Oh, damn it, she's got the virus.
I think we're all being tested.
Now, those were some scenes from the film Corona, Fear is a Virus. And as I mentioned earlier, I have Mustafa Kashvari, the director, on the line live to tell us more about his latest production. Hello, Mr. Kashvari.
Hi, thank you for having me on this show. And I hope all my Korean fellows are safe back home. And it's a pleasure to be on your show.
Thank you for being with us. Mr. Kashvari, first, could you tell us a bit about the plot of the movie? It hits really close to home right now, especially in light of the COVID-19 outbreak. Tell us a bit about the issues that you deal with as well.
Definitely. Yes, the name of the movie is simply Corona, and our tagline is Fear is a Virus. The idea came to me back in January when there were a lot of, I was in the elevator and I was reading a lot of news about Asian and especially the Chinese people globally being attacked, and I decided to make the movie in the elevator about the subject. And the elevator is a symbolism of the society we live in the world that we are sharing, and we all share this ride together. And basically, a bunch of people from different walks of life get on the elevator, and there is a fear of coronavirus in the building. And then a Chinese woman, step into the elevator, and they all start freaking out, and they get stuck in the elevator. And from there, they start, mislabeling her and trying to make assumption that she might have coronavirus. We don't know if she has it or not, but I think when the fear started spreading faster than the virus, people start showing their true colors. And I think the movie is more about xenophobia and racism than it's about coronavirus. It's using coronavirus as a symbol and metaphor of fear of each other. And we finished the film in February, and it's ready for distribution, and hoping that people will watch it very soon.
Right. Mr. Kashvari, you are from Canada, which is well known for being inclusive and multicultural. How has Canada responded to the COVID-19 outbreak as a community?
Yeah, I mean, Canada is doing really great. At the time when we made the film, there was no pandemic, so we made the film before the pandemic, and we had a very multicultural cast and crew. My costume designer is from Korea too, Jaewon Choi, who did a great job. And but after the pandemic, like a few weeks after the filming, everything shut down. There are restrictions right now, but I think one of the biggest issues is that a lot of people who have, Asian background, they're fighting in the front line, whether they're in the grocery shop or they're nurses or doctors in the healthcare system. They're Asians and they've been discriminated all over the world. So the movie is not here to question the origin of the virus, but the origin of racism and xenophobia that resides in human beings and takes different forms. And I think Canada, I've been lucky that I haven't personally seen any incident, but I know that there are incidents in Canada and everywhere in the world because under fear, again, people, our moral choices are challenged. And I think the movie is here to be a mirror for us to see what kind of moral choices we are making in this kind of situation. People are dying, but that doesn't mean that humanity should die with it too.
Right, that's a good point. Director Kashvari, just one last question for our viewers here. When is the movie set to be released, you said?
Right now, we are looking at different offers for distributions, but I think it's going to be released within a month, and I hope that it can also be viewed in Korea because it's a very relevant message, and I think it's going to make us more united as one human race. This virus doesn't belong to any particular race anymore. Therefore, us as human race must come together to fight it. And I hope this film will help us to understand each other better and look at each other not just by the color of the skin, but by the color of our actions and choices we make every day.
All right, Mr. Kashvari, thank you very much for your time today.
Thank you for having me. It's a great time.
Right, Professor Huang, as we just saw in the trailer, what can you tell us about the link between pandemic fears and racial discrimination?
Well, media report that the Chinese and Asian Americans in America, but other countries as well, are now experiencing the increased hate crime due to the, outbreak of the coronavirus. My family lives in a small town in the state of Washington, and which has the more of the damage from the pandemic, compared to the average state. They're staying home, hoping for the safety, just like any of the American family. But they have to have fear of getting infected as well as racially attacked. Face mask become the new social stigma, as Asians are usually wearing the mask, but other Westerners believe that doesn't really help much. Uncertainty was the cause of ignorance, caused by ignorance and fear. John Galbraith once said that modern society has more uncertainty than before because the society no longer provides or maintains the faith vision or strong or clear leadership to people, and increased level of uncertainty is the cause of discomfort. And when the society has a higher level of uncertainty, then because of fear, doubt, and general fear of uneasiness, it eventually leads to us to feel anxiety, and people try to avoid and lessen the level of anxiety. When the uncertainty level increases, it is high time that when some ambitious leaders were, the morons start to play the red game, blaming minority or victims of disease. Of course, long people recognize that they were being faked, but it will lead to too much damage already done.
Right. Professor Jiang, I suppose we can, to a certain extent, assume that those who are economically and socially disenfranchised may be more vulnerable to illnesses. Is it this reality then that makes minorities targets of suspicion and harassment, you think?
I think it's like Professor Huang said, that disadvantaged minorities are easier targets. They have less financial means. They often take public transit or in public schools where it's more crowded. And so they come face to face into confrontations with other people more often than people who have their own cars and live in more spacious areas. However, I would argue that even today, doctors and healthcare professionals who are Asian have high status, high incomes, but they're often subjected to this racial harassment. We have patients with COVID-19 who don't want to be treated by Asian doctors. And so the the doctors themselves are sort of surprised that they would get that type of response. But it just shows the deep-rooted fears that people have, the scapegoating that people have, and actually, you know, the hatred that's actually incited by political rhetoric. I think the political climate has really fueled the xenophobia and racism.
Jason, earlier on you mentioned about the impact of journalism in stopping or even sparking racism. What ways perhaps can you ensure, or can journalists ensure, to make sure that such racist incidents do not occur?
Sure. Well, I mean, I think a good move has been to stop calling the epidemic the Chinese virus or linking it directly to Wuhan.
All right.
It's, you know, and unfortunately some political leaders and some media continue to do that. But calling it COVID-19 certainly kind of detaches it. So that's one step.
All right. Jason, thank you for those thoughts. Professor Tsiang, thank you for being with us today. And Professor Huang, thank you very much for your thoughts today.
Pleasure of mine.
Thank you.
Right, well, that is all the time we have for today. Korea will be holding its general elections tomorrow amid the COVID-19 pandemic. We'll have more on that in Wednesday's edition, so be sure to tune in. In the meantime, do share your thoughts and inquiries with us through our social media accounts or our homepage, arirang.com. Thank you, as always, for being with us.